Next up in our list of speakers is Miss Jessica Kennedy.
Hello, Jessica. Thank you so much for coming to my doctor's office today. I am Dr. Kennedy. Let's see here. My nurse, Anna, she says you have some concerns about your health. Maybe you can tell me some more. Jessica, can I stop you right there? You're deaf. Can you read my lips? Read my lips? Can you read my lips? No, you can't. When I was a little girl, another little girl at summer camp, she could read my lips. You can't. Jessica, have you considered how a hearing aid or cochlear implant could really change your life?
Hi all. This is the real Jessica Kennedy. I'm not a doctor. I'm not, but I am deaf. And I am the president of Deaf Health, and we are a radically different advocacy organization because we are authentically deaf and our talent and background varies. We have legal, marketing, public health. So that appointment that you all witnessed, we all watched together just now, was probably very different for you all. You couldn't understand what it was that I was signing. I wasn't using my voice for that section. You might have been able to pick up on little parts of it here and there. You were trying to understand little bits of it. Maybe overall you might have got the gist of things, the gist of what was going on. All of that is the culmination of my experience when I visit a doctor's office without an accommodation, the accommodations that I need, which would be a sign language interpreter. Lip reading is successful about 30 to 40% of the time only. And writing notes back and forth, most deaf people do not read English well enough. And the reason why is because English and American Sign Language are very different languages. Even myself, I read and understand English well, but I do not like writing notes back and forth with my doctor. It makes me feel like I am at an auto body shop and I'm going to talk with my mechanic. This is my body. This is my future, my family. I want that human interaction, human engagement. So you might have noticed that my signing in the appointment looked very emotional, even if you didn't understand sign language. There was fear in it. It was layered. It was layered with grief, but the doctor completely overlooked that because she could only see my disability. That entire experience, that whole story is very common for the deaf community. Not fully understanding, not being able to fully participate, and that feeling of being overlooked, that experience of being overlooked. And more than once, my experience has been that. Almost 70% of physicians admit that they recognize that they are at risk for a lawsuit under the Americans with Disabilities Act. The acronym for that is the ADA.
Mm-hmm.
Over 1/3 of physicians admit that they only know little or nothing about the ADA. Altogether, that means that I don't or I can't trust if I'm actually going to be receiving the accommodation that I need when I have an appointment. For most deaf people, this is the same. Even if the doctor's office promises, yes, you'll have an interpreter there, this is going to happen. Sometimes the interpreter doesn't show up, but oftentimes if they're using the technology fails. Sometimes the accommodation that they provide isn't actually the appropriate for that type of appointment. All of this connects to trust. We compared hearing individuals to deaf signing individuals, and comparatively, deaf signing individuals are 97% more likely to visit the emergency room. I'll say that again, 97% more likely to go to the ER. Why is that? Well, there wasn't a exactly cause and analysis, but I can tell you, we face flat out discrimination. We are dismissed. There are so many times that we don't receive the accommodations that we need. Another reason is flat out bias. We're put down. Comments are made. They don't understand what's culturally appropriate. And the other reason is total lack of accessible information. When I visit a doctor's office as opposed to going to the emergency room, how do I access the system? Insurance. The insurance system is so complicated, and all of these things together it's exhausting. It's exhausting to try to navigate that and deal with that every time you go to see the doctor. It's not all right. It's absurdly not all right. And then on top of that, the deaf community then shoulders the burden of the consequences. We have considerably less trust in our healthcare providers. We have severe health disparities, and our health outcomes are considerably worse. It's not all right. But thank you for being here today. Thank you for listening. Thank you for watching. We're done.
Thank you. Thank you, Jessica. I was reading the chat because I knew what was coming in your presentation, but the audience didn't. And so I think that that experience for us viewing this and, you know, seeing what an encounter could be like really was really moving. Yeah. So thank you so much.